Welcome to AFibulous Life, Unlimited Conversation, the podcast where we explore what it really means to live, adapt, and thrive with atrial fibrillation. Hosted by Jim Kaveney, this is a space for real stories, expert insights, and honest conversations about heart health, resilience, and life beyond diagnosis, because AFib doesn't define you. And with the right support, your life can still be unlimited.
Hello and welcome back to AFibulous Life, Unlimited Conversation. I'm excited to be rolling out episode number 2 today with a dear friend of mine, Deb Halligan. We'll get into Deb in a second or two here, but as we talk a little bit about what this mission is for AFibulous Life, remember it's built on a simple but powerful belief. Everybody can become a center of excellence. Now, the whole idea of the podcast is to explore how individuals, patients, caregivers, and clinicians can live fully and perform at their best by embracing whole person care. Now, what does that mean? That means combining lifestyle medicine, behavioral and psychological resilience, clinical excellence. Now, our goal is to show that living with AFib or any type of chronic disease is not a limitation. It should be an opportunity to transform pain into purpose and to build an AFibulous life. And so today's episode is going to be an exciting one because we're going to be talking about the journey and leadership in cardiac care and what my friend brings to the table today. And what about the intersection of clinical care, lifestyle, and behavior change as well? So as we talk to Deb today and the real world insights that we're going to gain from this, we're going to chat a little bit about some of these ways in which we can improve outcomes for patients living with AFib. Now, I have to qualify, I am not a healthcare provider, so don't take my advice at all. Deb, though, is, and she can provide her qualifications. And our goal here is to really to talk about lifestyle, not really to implore anybody do anything outside of the direction of their direct healthcare providers. So with that, Deb, welcome to AFibulous Life, Unlimited Conversation. Welcome to the first episode.
Thank you, Jim. It's good to see you. I love that this is your new forum. You're doing an awesome job.
Well, thank you. We're making it up as we go along, so we'll see how this goes. But I am so grateful that you're here, and I think you're the perfect guest for this because, I said Deb is my dear friend, which she is now. But 2 years ago, I had no idea who Deb was, and so we just happened to bump into each other at a conference. And I was starting my business up, and I ran in. Actually, I almost tackled you coming off the stage, and said, "Oh my gosh, I'm trying to do everything that you're doing." And you said, "Here's my card. Call me, and we'll see if we can figure something out." So here we are together, almost 2 years, now building a friendship and a professional respect for each other and what you're doing and what we're doing collectively as a group. So welcome. And so Deb, before we dive into any of this, give a little bit of background. I mean, who are you? What are you? What do you do? How do you live every day?
So my name is Deb Halligan. I am a nurse. I've been a nurse for over 30 years, which is really bizarre to say out loud. But here I am. But nursing has afforded me just the best work experience. I spent the first 20 years of my nursing at the bedside, critical care, open heart surgery, and cardiac devices. So I ran an implantable cardiac device clinic. Okay. We were one of the first we were the early adopters for remote monitoring. Because of that, I got to work with St. Jude, Abbott, Boston Scientific, Biotronic, Medtronic, all the companies that make these devices, and go out and teach other allied health professionals on how to set up these clinics. I also got to publish in EP Lab Digest. Most of you people have never heard of that, but that's for electrophysiology, which is the electrical part of your heart. And again, just talking about how to set up these clinics. So at the time, Yuri Sudakar, who is our CEO of Nudj Health, read that article and was able to get in touch with me. And he said, come over to the dark side. Let's go, become a vendor with me. And we created the first service for remote monitoring. So service and technology for remote monitoring of cardiac devices.
Wow.
Yeah, it's pretty cool. So I got to see the business side of things. And while we sold that in 2019, But during that time, we started to really put together um, the or the behavior behind cardiac, like compliance. So patients who were compliant using their devices, or if we started to see patients that were having more ectopy or more arrhythmias, which are abnormal heartbeats. When we got those patients on the phone, a lot of times we were able to find a direct correlation between something that was going on in their life that was causing either their lower compliance of using their device or having more arrhythmias.
Okay.
And that's really where the idea for Nudj Health was born. And so that is our current company, which is we're a virtual lifestyle medicine company. We deliver all services for fitness, nutrition, stress management, sleep, social support virtually.
Okay. That's wonderful. What an awesome background, right? And I think as you went from bedside right into the cardiac side of things and everything else, quick question for you on that is like, what have you seen in your 30 plus years of experience? What truly helps patients heal? As you go from your experience on the bedside now to working remotely, and tell me a little bit about that.
So I look at recovery or healing, there's a lot of different aspects along the way. So when I was in critical care, it was literally just keeping people alive, right?
Okay.
And we did a really good job at that. So I never really got to see like, well, what did life look like after they went through this really intense time? So that's one of the reasons I moved into the device clinic was because from there, I would get to have relationships with patients and see them 4 times a year. And what I found, and this is really when I started to get an interest in coaching with people too, we all need a coach.
Yeah.
I can't tell you, Jim, how many people are my own personal team to keep me up and going and doing things. And so to me, it's success, recovery, it's not linear. And I think we're conditioned to the quick fix, the easy way out, when there really isn't. Our bodies are going to heal the way they heal,
Right.
and the time that they're going to heal. So having an accountability partner, someone to coach, I have found to be probably one of the most important things in anyone's road to recovery for
Yeah.
whatever it is.
I love that concept, right? Because I think one of the key things that you guys have done well at Nudj, and one of the key things that I've always enjoyed too, is being a part of a community, right? And I think that's, it could be 2 people, 3 people, 5 people, 10 people, right? Whatever you need, right? And I think, I was talking to a physician a few weeks ago, and this shocked me. I don't know why I didn't even think of this, but he said the number one social determinant for health is loneliness, right?
Mm-hmm.
And I don't think with the amount of people that we have on this planet, there's any room or space for people to be alone in any part of their journey, right? So I appreciate you bringing up that comment about, it takes a village to do this.
And honestly, Jim, this is the loneliest we've ever been. So
Right.
if you look at you would think that we're more connected with all the ways that we can connect, and in fact, people are more isolated than ever today.
Right.
So having that community around you during, finding out a diagnosis, figuring out living with that diagnosis, new medications, new procedures, all those things, having someone to walk this with you it's everything.
Yeah. Yeah, no, you're absolutely right. And speaking, as once you get diagnosed, and I often think about my own experience when I was diagnosed, the kind of what I went through in my own journey to kind of figure it out. With your experience in this space, what do you think the system currently does well, and then where does it fall short? And then how do we help patients with AFib kind of understand what those failings are, not out of malice or intent, right? It's just the way the system is. But what are your thoughts there?
We are awesome at diagnosing, We are awesome at stroke prevention, uh, ablations, so those treatments. So I would say diagnosing. So by EKG, wearing a patch, wearing a monitor, and then once you're diagnosed, you are immediately started on a medication to help prevent a stroke, and then you're probably set up to have an ablation in your future, right? But there is a huge gap that's missing, which is lifestyle modifications. And this is where I get on my soapbox. So
I love it. Let's do it
now. But lifestyle modifications, meaning making changes in nutrition, fitness, sleep, stress management, having that, support system. These are all class 1A recommendations in almost across every single disease state. What class 1A means is it's safe and it works.
Right.
But now, who actually delivers that? It's spotty at best. We know that there are different governing bodies and different academic bodies out there that are really trying to push lifestyle as a pillar of treatment. But in the current system that we have, where you are incentivized to see more patients in less time, when are you going to coach?
Right.
So it's not the doctor's job to coach the patient. The doctor, the expert, is there to get you the medications, get you in for the ablation. But then there's a whole other team of experts that can be working with you through health coaching to improve your lifestyle, which ultimately, in studies show losing weight, it can decrease your AFib burden.
Right.
Exercise, better sleep, improving your sleep apnea or treating your sleep apnea. There's a body of evidence that shows that lifestyle does have an impact on your AFib burden. And in fact, if you look at the Prague 25 trial, even though we know that ablation is superior to lifestyle, it did show, which I love this, that the quality of life in the two groups was the same.
Yeah.
So what, to me, I interpret that as patients, they may still have the AFib, but because they are healthier, are not as symptomatic with it.
Right. And what's interesting, and I love the fact that I completely forgot about that trial specifically, but I love the fact that you brought it up around the quality of life, right? Because that's really the premise really around AFibulous life, right? Because I remember listening to a couple of physicians that were saying, hey, my patients 10, 15 years ago used to want as many years as possible, regardless of how they felt. But now that's shifted, right? And so people are waking up and they're saying, now give me 10 really quality years over 20 kind of crappy years, right? So I think that's really important. And that's where AFibulous Life came out of, right? So let's talk a little bit about that, because your work at Nudj, you talk about meeting patients where they are. And how does that work for somebody that's newly diagnosed, coming in, maybe in between doctor's appointments, things like that? Like, how do you fill that gap?
So right now, we have a few ways patients are typically referred to us through their physician. We can also have patients self-pay who come in and pay a certain amount of money to have health coaching, virtual health coaching through the month. So sorry, go back to the question. Lost my...
Yeah, no. So we often talk with Nudj, like you guys meet patients where they are, right? So what does that look like in practice?
So when we meet our patient, we are doing assessments, clinically validated assessments across all 6 lifestyle areas. But we're also asking the patient, what brought you here? Like, if you could change one thing in your life, what would it be? So getting an idea of where they're struggling. And then we do all of these assessments, and based on the assessments and where the patient wants to start, they go into a lifestyle program that's typically 16 weeks long, where they get group education and one-on-ones with their health coaches. Their health coaches are their buddy, right? Their partner in crime, if you will, through this journey. So it's the health coach's job to work with the patient to set realistic goals. But when I say that, I love to take exercise. So you have someone who's never exercised. You're not going to start them out on, you're going to 20 minutes a day walking
Sure.
or something, right?
Sure.
You're going to break it down to what gets in your way of exercising. And it might be their goal for that day might be to, when you go to bed at night, put your sneakers next to your bed. 3 days a week, right?
Yeah.
So we're breaking the goal down to a point where it's successful and it's repeatable. So then now the patient has that psychological boost of, hey, I did that. I can do this. Let's add more. And so then we just start, ratcheting up those goals until they finally get to their outcome goal.
Yeah. No, I love that. And I was just reading a book the other day too, which I've heard it so many different times, but they were talking about when you look at behavior change, that the confidence to make those changes doesn't come in your mind. It comes by doing the action. So to your point, that small little step, hey, there's shoes in front of my bed. I'm going to put them on. I'm going to go for a walk for 5 minutes. And then you build up that, that mental success key, right? And then you keep telling yourself, hey, I did this yesterday. I can do this again in 2 days or do it again tomorrow. So it's so great. So thank you for sharing that whole concept around how you guys tackle that and really meet the patients where they're at. Now, when you think about the small lifestyle changes that lead to meaningful improvements, is there anyone in particular that kind of stands out for patients in general? I know your experience with AFib patients, or are they all kind of different?
I think it's very personal where people want to start and what matters to them. I think the most important thing that we do is we identify, first of all, where they are in behavior change, right? Are they ready to make changes?
Yeah.
Or, are they suffering from any sort of depression and anxiety that's going to limit them from making these? So then we work on those areas first. So it really it's patient dependent, and that's what is wonderful about this, because it's all curated towards the individual.
Right. Yeah, and I love that because I think about, I guess, my N of one, my experience, right? I was always an athlete, always very active. So for me, getting up and every day and working out or trying to eat healthy was never a problem. My disease took over. I just didn't know how to really address those things, right? But so to your point, like it is all about finding something different for somebody else, right? Because we're an N of one for the most part. But the concept around helping people become their own center of excellence. What are your thoughts around that concept? Because back to your point, right? In the current system that we live in, it's a challenge, right? And everybody can slap up a moniker on their hospital system and say, hey, we're a center of excellence. And most likely they are in some area. But I think it's so much more impactful if the patients themselves feel empowered to believe that too. So what are your thoughts around lifestyle modification and that helping people to kind of feel that way, that they can become a center of excellence themselves?
I love that you're calling people a center of excellence, right? Because I think a lot of us have been conditioned to think that a lot of these things are outside of our control. When in fact, if you look at genetics, genetics are actually lower on what causes chronic disease than where you live, right? So
Right.
giving people basic health education to understand what's going on, because if you get a diagnosis like AFib, it's scary. It's your heart,
Right.
right? And then it's you don't feel well. It's all these new medications. It's all these new procedures you have to do. You might have to get a pacemaker. So it's your life literally changes in that moment. So by becoming a center of excellence, it's really breaking down, okay, what is going on with me right now? Again, having someone, a family member or a friend that can work with you through these questions when you're starting to get the diagnosis, but doing your own research, reaching out to friends or family that might be nurses or doctors that you can talk to.
Yeah.
I don't recommend going on, unless you research is you want to talk to
Yeah.
people, right?
Right.
So, because you can read some pretty scary stuff.
Yeah.
You want to have the time with your provider, and that's really hard to get. So is there another avenue within that office that maybe there's an AFib clinic, maybe there's a nurse practitioner that can spend more time with you, really starting to understand how the disease affects you, but more importantly, I think, is what can I do to improve how I feel?
Yeah. 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 That is
Because you have people who have silent AFib never feel it, right? It has
right.
nothing, and that's actually kind of scary and dangerous because they're really at risk for a stroke. But then you have people who are really, really symptomatic with it. So finding what is it that I can do? What do I have control over? What can I improve? And
Yeah.
then working with a company like Nudj to help you break those goals down and meet those outcome goals that you're looking for.
Yeah. No, that's great. And I want to highlight too, because you brought up the important point of the silent AFib, right? Which is roughly about 30% of the population, which is significant.
Mhm.
And so when you look at sheer numbers in the United States alone, we're sitting at roughly around 6 to 7 million patients now. They're projecting 12 million patients in 4 years. So if you're looking at 30% of that population being silent, kind of walking around not knowing, that is scary, right? And so I think that also emphasizes the whole fact that we all, regardless of diagnosis or not, should be taking care of ourselves a little bit better, right? And so, and that's a whole nother story. But regardless, but you brought up some other key points in there too around caregiving, right? And I often think about, I was diagnosed when I was 38, so my two kids were, 6 and 7, so they weren't going to really do too much for me outside of show me how tired I was trying to chase them around when my heart was skipping a beat. But then there was my wife that pretty much did what she had to do as a caregiver. So let's talk a little bit about the caregiving side of it, because I think the caregivers themselves often get neglected. And how do
Mhm.
we help to create that environment, right? Because you had mentioned, hey, it depends on where you live. As we look at that center of excellence, it's
Mhm.
not just you, it's everybody around you. Like, tell me a little bit about that and your experience in connecting with some caregivers.
So, I mean, caregivers are honestly the unsung heroes of this country. If you think about most caregivers are the sandwich generation, so they've got
Yeah,
kids that they're still just like with you're saying about your wife. You got little ones at home, maybe teenagers, and then you've got your parents too, and you probably throw in there a full-time job.
yeah,
And limited resources as all the boomers are starting to retire. And I'm speaking from my own personal experience as a
yeah,
caregiver as well. They need the same amount of support, right? It is a very lonely place to be caregiving, especially when it's two elderly people who are home alone.
right,
Um, so, or you might be the child caregiver, and you might have brothers, sisters in other states who are very critical of what you're doing. That's not my
right.
story, by the way. I'm just saying this is what happens. So,
Yeah, yep,
so caregivers have a lot of guilt. They feel like they're never doing
they do,
enough,
they do.
and then they are neglecting their own care and the things that they have to do to stay healthy.
Yeah,
So how can we support them? You know, the getting them out of isolation, making sure that they're connecting with their group of people in their community. There's local support groups, especially the Council on Aging in every town. A good therapist,
yeah,
and prioritizing your own health. So again, putting, as they say when they're going through when you're on an airplane, to put on your own oxygen first.
right.
Got to do that. And just a quick little anecdote. I mean, I had my knee replaced about it'll be 6 weeks. So it was just me and my husband, and I thought, I'll be easy. I'm going to
Yeah,
be an easy patient. That poor man. I saw what what a healthy man went through as a primary caregiver to an otherwise healthy wife who was down and out for a good 2 weeks. That was only 2 weeks, Jim.
Yeah. Yeah.
It was so stressful. And I was like, my God, I just, we've got to do more for health, for our caregivers.
Without question. Yeah, without question. Yeah, and I mean, I think about my own personal journey. I was living, both my parents are passed, but I was 9 hours away from them. And so my 7 siblings back at home, I never judged them because I knew that they had the yeoman's task of taking care of both of them. My dad with vascular dementia, which I'm projecting he probably had silent AFib throughout his life because because we know that there's a hereditary component to AFib. So I share a name, but I also think I share a disease a little bit with my dad. I just hope that doesn't turn into vascular dementia. That's why I do what I do every single day. But you're so right around the caregivers, and I love the the analogy about the putting the oxygen mask on first, because if they're not strong, then they can't take care of somebody else in the right way, and it's so important. And I think if there be a way to couple lifestyle modification programming so that the caregivers are also included, right? I mean, I think that should be fundamentally included in any type of reimbursement programs that are out there, either private or public insurance, right? So it's just so important for everybody to remain healthy. So I want to shift a little bit to obviously you've done significant national scale initiatives with now Nudj and what your prior company is now. What do you think is the biggest hindrance to lifestyle medicine really becoming a part of the larger kind of initiative? Like it should be a go-to all the time.
Well, things in healthcare move at a snail's pace. So it literally takes 20 years to truly initiate something new within healthcare. So we're 5 years into this, right? Or
Yep.
ACLM has been around for 10 years, I think. I don't know the number, but I do know that they are the fastest growing medical body or medical college. But how do we get it into healthcare? Well, first of all, the 15-minute visit is not going to cut it. One. Two, reimbursement has to change. So there's a lot of work being done at the CMS level right now to really look at lifestyle medicine and the proper reimbursement around it.
Yeah.
So it's more of a value based than a fee for service. You don't have to go ahead and create your own lifestyle medicine program because it's going to take a lot of resources. You need expert registered dietitians, exercise physiologists, social workers, certified health coaches, psychiatrists, the list goes on and on.
Sure.
And I'm going to go ahead and plug Nudj Health here while we're talking about it. We are literally a plug and play service provider.
Yeah.
So we have the technology, we have the experts, we work together, and we then become your virtual lifestyle team for your patients.
Yeah. No, and I love that, and I love what you've been able to do. And I think too, in prior discussions too, it's where there's not that many healthcare providers anymore, right? We have a negative outcome in those areas, so you guys can potentially fill the void of where there's some gaps in care, right? Too.
Yes, I mean, think of your Medicaid populations, your rural populations, and even though we are virtual, it can be low tech virtual too. It can be phone calls, so we have an answer for those areas that might be lower saturation of Wi-Fi or computer literacy.
Yeah, yeah. No, it's definitely a big initiative that you guys are undertaking, and it does take time, and it's meaningful, right? So it's not going to be a flash in the pan and overnight success, but it comes by hard work, and you guys are doing some great stuff. So let's shift a little bit back to heart health, particularly AFib. What do you think is some of the biggest misconceptions about AFib or heart health in general?
Well, I think with AFib, if my AFib is permanent, lifestyle changes aren't going to help. And I want to go back to the study we cited earlier, which is the
Yeah.
Prague 25 and the Legacy trial. Even it showed all those studies show that weight loss, sleep apnea treatment, alcohol reduction, blood pressure control, all have been shown to reduce the burden of AFib and the recurrence. And again, and the quality of life piece
Right.
improves.
Right.
I think that's the biggest part, right? Once you start feeling better, the things that I've never had AFib, but I can imagine it's similar to chronic pain in a way where it's all you can think about, right? Like that's the focus, especially if you're symptomatic. Like you're just focused on that feeling.
Right.
And when you start to feel physically better, that focus starts to shift.
Right.
And so I would say that that's a big myth with AFib, is that it doesn't matter. It's not going to make a difference. This is the rest of my life. This is what it's going to be. And I challenge you and the audience to say, no, there's something better out there.
Right.
There is.
Right. Yeah, and that's the whole thing, right? The back to the center of excellence concept, right? So even if you are in a weakened state, right? And my own personal experience, I mean, when I was 38 years old, and I quickly moved to be like a 90-year-old guy with emphysema. Like I couldn't walk up the stairs. It was pretty bad. I do have a pacemaker now. It doesn't do anything. So to your point, right? Like unless I see myself with my shirt off, like I forget that I was an AFib patient, right? And I also sometimes wonder, like, is that good for my mindset to say I am an AFib patient, right? But because I'm not really technically anymore. I've been AFib free for 7 years. I hope to God that doesn't ever come back, because I know what you were talking about. Because if you go out and you have a meal, oh my gosh, is something going to trigger me, right? Or if you do something fun, is that going to trigger me? You know, you just never know what it was, and that was always in the back of your mind. But now I don't. Every once in a while, you know, I'll feel my watch might do a little something to me, and I'll be like, do I need to worry about anything? But I just ignore it and move forward. So I appreciate.
Let me ask you something. How long did it take you to get to that other side, right? To go from feeling the way that you did. So I'm going to switch the script on you here for a second.
The guest becomes the interviewer.
How long did it take for you to go from feeling the way that you did, and then you felt better, but what did you have to do to get to acceptance and then get to a point where you don't even think about it anymore?
Yeah, so it's interesting, right? And I'm probably not the best case study for this, but when you're 38 and diagnosed, you often think this is no big deal, right? I got this, right? And I can remember my first cardiology appointment that I went to, and the guy's like, well, we could do a procedure called an ablation, or we could, start you on some medicine. I'm like, I don't need an ablation. Like, I'm good, right? I'm 38. I'm going to get over this. And that's when the beta blockers came. And then that's when the beta blockers made me feel like a 90-year-old. And then I was forever put on calcium channel after that, and the calcium channel blockers helped me a little bit. But, my disease unfortunately progressed. I went from paroxysmal, had an ablation, and then I think the ablation led to, cardioversion, because then a flutter came out of it, and then I felt good for probably about 3 months, and then it came back. And then I'm like, okay, this is my new normal, right? And it came back paroxysmally, and then eventually it just became permanent. And then I'm like, all right, this is it, right? This is my new lifestyle. And I kept working out. I kept eating pretty good. Wasn't great on the, I've never been a huge drinker, but, I'd like to, I'm an Irish guy, so I'll go out and throw back a couple pints with my boys. But then it started, then whether you want to call it, it transformed into Tachy-Brady syndrome. But then it got to a point where, like, I was running probably about 125, 130 beats per minute was my resting heart rate. And I was like, then that's what I thought was normal, until then I started passing out. Then I went and finally, long story short, they put a patch on me to figure out what was going on, and they're like, you have Tachy-Brady syndrome, and you're having 6-second pauses 40 times to 50 times a month. And so uh, my quality of life was not great, but I kept persisting. I mean, I was like, I'm good. I'm gonna keep lifting weights. I'm gonna keep doing my thing. And then at work, people would look at me and they're like, why are you just leaning up against the chair? Like, why can't you lift your head? You know, and you look pale. Well, I look pale because I'm getting blood anywhere, right? So yeah, so I'm probably not, and I think that's probably why I'm so passionate about this now, Deb, is because for as self-proclaimed educated as I was quite ignorant on how I should have been managing that. And so that's why I'm so excited to have met you and meet this and understand that there's a larger mission out there around lifestyle modification, because I could have done so many different things. So I would have probably been a little bit more proactive in my conversations with my cardiologist and EPs as well to say, hey, let's get this thing fixed like once and for all, you know. So
Right.
so that's a
Right.
long answer to your short question, but I didn't. It took probably 2 years, 2 years, 3 years for me to actually feel great.
And it's a journey, right? And it's not linear. So that's what I want to go back to. Like
Yeah,
health is a journey. It's not it's not fast. And I think if people can start to understand like things are going to move the way that they're going to move and know that they're making the right steps forward, they're going to feel better.
yeah,
So there is hope, and that's what I'm trying to say is that
yep,
you can feel better. Yes, you might have AFib for the rest of your life or be called an AFib patient, but you can feel better. You
right.
can enjoy life. You can have quality.
Yeah, you can have an AFibulous life, Deb.
An
It's definitely,
AFibulous life, what a perfect way to end that.
yeah, an AFibulous life without question. No, and I appreciate that, and that is so true too. And I actually remember this. This was a not a random call, but a distant family member of mine. He is a anesthesiologist, same age, maybe 54. He was diagnosed with AFib a couple years ago. Went for his first ablation last fall, and then his wife called me and said, you know, Jimmy, he's not following what the doctors told him to do, right? Well, here he is, an anesthesiologist, right? He's very smart. So she's like, can I have him call you? And I said, 100%. So he called me, and he's like, what am I doing wrong? And I'm like, well, first, I'm very humbled. You're an anesthesiologist calling me for advice. And come to find out, like he was a CrossFitter, like he was always aggressive, always into that. And I'm like, listen, sometimes you might just have to realize, like, maybe you can't do that anymore. And I said, why don't you try walking and lifting weights heavy rather than trying to throw up 65,000 pounds and run with it down the street? You know, I'm like, probably about 10 days later, he calls me and he's like, I've been AFib free. I still feel great. Like I'm not having any further bursts and spikes of my arrhythmias or anything. I feel awesome. Saw him about a year ago, or excuse me, 6 months ago, and he's like, I'm golden, right? So just those small suggestions, right? He still is able to maintain his fitness, but he's just doing things a little different. And trust me, I hated to run anyways before my AFib. So now for me to go out and walk 10,000 steps every day, it's a piece of cake, and that's helped. That helps me. So, but
So it's a mind shift, and yeah, the mind shifts are hard when you're with any sort of diagnosis or aging. You know, our bodies don't act the same way they did a few years ago, but our brains are still telling us they
yeah,
do.
yeah,
So, yeah,
with,
yeah.
without a doubt. So kind of wrapping a few things up here.
Mhm.
If somebody does, feel overwhelmed by their diagnosis and everything else, and what do you think is the best first steps they can take to get started to stop feeling overwhelmed?
It's a great question. Um, for me, I find, you know, my doing research, but again, I'm a nurse. I know where to look, but there's some great patient sites. We have the stopafib.org is a wonderful place for patients to go to.
Yep.
And that's very patient centered. It's great education, and it's obviously AFib centered.
All right.
So having your community, making some goals around your lifestyle? Are there changes that you can make? Is there someone that you can do it with? Does your doctor have a lifestyle group, or coming into Nudj Health to do it as well? So I think really developing your community, understanding what's going on, so that you yourself can kind of come up with what your plan is. So I think the overwhelm lasts differently for people. If overwhelm is staying with you and you're unable to get out of it, then you probably need a therapist and someone to work with to help you get out of that.
Yeah.
So that you then can go ahead and accept what's happening and then make those changes that you need to make.
No, I love it. I love it, Deb. And that is a great way to close up our episode today, because I think as your emphasis is that they're not alone, right?
Yeah.
We're not alone. Nobody's alone, or shouldn't be alone. And they actually have more control over their health than they think.
Mm-hmm.
It's within themselves, right? And that's why I appreciate that whole idea of the center of excellence, because it's all within us. We just need to find it, right? And so I think we can. And so I am so happy that you were able to spend some time with me today on the second episode of AFibulous Life, Unlimited Conversation. So, and just a quick little update too for those as we segue into the next episode. So we will have, probably in the next 2 weeks, we're going to have Melanie True Hills as our next guest, who is the founder of StopAFib.org. So she is just a powerhouse when it comes to AFib knowledge, but being a patient herself. So, but in the meantime, Deb, thank you so much for sharing your journey in helping people, most importantly, but also just your friendship with me and everything else we're trying to do collectively. So thank you, folks. Enjoy the rest of your afternoon. Deb, enjoy your talk to you soon.
Yes, Jim, thank you so much. Great job.
Thank you. All right. Thanks, Deb. Bye-bye.
Bye.